Doug. Thank you. Well, Dr. Kristen Simpson is here with Simpson Dental Associates. If you have a question for the doctor, you can call 1-877-924-7888 while we wait for some calls. One thing I was kind of wanting to ask you about, you go to the dentist, you're going to get an x-ray taken of your teeth.
Yes.
They put that big old thing over your chest.
Right.
So how much radiation is someone exposed to when they're getting x-rays made there?
That's a good question. A lot of people get worried about that. They come to the dentist and they're like, I don't really want the x-rays taken because I just had a medical scan done and I feel like I'm going to be glowing in the dark. We'll hear things like that all the time. But, really with dental advances that we have today, the digital radiography that we have is much lower radiation than you can get even from sitting in front of the TV, just watching TV. They measure it like millirem is what they measure radiation in.
Sure.
And 0.15 millirem is what a single digital x-ray is. And you get about 5 millirem from a flight. Just across the country. So, you get much more just on regular daily exposure, and these dental x-rays can really help us to get a good diagnosis for what we need to treat your mouth.
All right. How does someone know if they have gum disease? What are the signs of that?
Right. Well, if you have inflammation in your gums, that's definitely one of the first signs of gum disease. If your gums are bleeding when you're brushing and flossing, some people think, oh, well, my gums just bleed all the time. Well, if they're bleeding, it means you have the start of gum disease, which is gingivitis. And also bad breath can be a sign of gum disease, too.
Okay. Well, we got a call from Henry. Henry,
Okay.
Good morning. What's your question for the doctor?
Are you there?
Sorry.
Henry, good morning. What's your question for Dr. Simpson?
He's 5, and he's already lost 5 teeth, and some people are saying it's too many. And I was just wondering what the average is.
Okay, yes. Well, children develop at many different ages, so it's hard to tell when they'll lose their teeth and when they'll get their teeth. If they're losing the teeth, what seems to be an early age, you might want to go to the dentist and make sure that those permanent teeth are coming in behind them. They can just take an x-ray to be able to tell where the permanent teeth are developing. So that might be something you want to check for sure, but really, kids developing at many different ages is normal. Yeah.
All right, Henry, thank you for your call.
Yes.
Now, let's talk, what's the difference between a crown, a crown
Yes.
and a veneer?
Yes. Well, a crown actually covers the whole tooth.
Okay.
So if you have like a large filling in the tooth that needs replaced, you might need the support of a crown. If you just want to do something aesthetic, like on the front teeth, a veneer would be what you would use, and a veneer just covers the front of the tooth and the edge of the tooth. So it's a more minimally invasive type of restoration.
Okay. We got a call from John. John, good morning. What's your question for the doctor?
Yes. I had a tooth extracted. It left a hole in the gum, and everything that gets in there, water, coffee, anything, goes in that hole, causes severe pain like a toothache. Do they put a stitch in there to cover that or something?
Well, what you could be experiencing is what's called dry socket, and that means that there's exposed bone at the bottom of that socket where the tooth was taken out, and it just means that that tissue hasn't healed over where that tooth has been extracted. It takes some time for the tissue to heal and for that bone to reform. So they can do some things to cover up that bone while it continues to heal. It's like a pack that they put into that area. So that's something that you might try.
You should probably get that checked out, right?
Yeah, definitely.
That sounds like it would hurt.
Right.
Ouch.
Yeah.
All right, John, thank you for your call. That's another good question.
Yes.
All right, well, we covered a lot of topics today. Dr.
We
Simpson,
did.
thanks for coming in.
Sure.
All right, coming up next, Exodus is the latest biblical movie to